Pacific people are underrepresented in the nurses that care for them here at Counties Manukau. We know that we need a lot more Pacific registered nurses to reflect our population. Over coming years, we want to see if we can change a few little things to see if we can actually increase that number.
We really recognise the importance of leadership as a graduate capability in future Pacific registered nurses, but we also have an understanding that leadership qualities and skills actually take time to develop.
What we're hoping to do with them is give them little snack bites of leadership activities right from week 1 of their program throughout their 3 years to see if these leadership interventions and role modelling will actually add something to what they've got to offer at the end. The 2 project leads are Jane Kelly from MIT and myself from Counties Manukau. Our project sponsors are Willem Furi from MIT and Toa Whareti here from Counties Manukau, and we have a governance group of some key Pacific leaders from the 2 organisations.
As the lead sponsor, I could see that there was a gap for the undergraduates year 1. It is getting our Pacific nurse leaders in front of our Pacific nursing students so that they can offer advice, support, mentor. You know, these are the leadership roles that they can aspire to be able to help influence decision making with it, for our Pacific communities.
What we've done so far is we first of all went and saw the students, told them what we wanted to do, got their buy-in and their agreement. Then a team from Ko Awatea went over and spent some time with the students, further talked to them about the project aims and helped them choose a name for this project.
The reason Pacifica 274 was chosen by the students was A, 2 stands for Healthy Together 2020. They selected 7 as being the 7 Pacific Island nations represented in the classroom at the time, and 4 was for the concepts involved in the project, Pacific Nursing Workforce Leadership. It was after the name was chosen that we discovered that 274 is the telephone code for Otara, and it resonated with the community and the students.
Then we had a schedule of 3 key speakers that are Pacific women from counties in various leadership positions. They went over 3 consecutive weeks, and after each session we surveyed the students in terms of their engagement and their leadership skill development.
The results from the baseline survey that we took showed us that just more than 50% of the students would choose Counties Manukau Health as a preferred employer right now. But what was really interesting is that when we asked them why would they like to work in that particular area, predominantly all students were interested in wanting to give back to their people and give back to the community.
Our 2 organisations already have a really good relationship in terms of developing Pacific nurse leaders of the future.
And now, through this project, we will shift the development of those future Pacific registered nurses from good to really great.